Did you know that nearly half of all premature deaths are due to behavioral and other preventable causes? Right now, as you're listening, your body is sending you 4 critical signals that could actually save your life. The top 2 causes of death for senior citizens in 2022 were heart diseases and cancer, at just over 1,800 deaths per 100,000 people. Most seniors tend to dismiss these daily warnings as just getting old, but they're actually desperate SOS signals from a body fighting for survival. Are you listening to these 4 death warnings that your body sends every single day? Because by the end of this video, you'll know exactly what to watch for. And honestly, it could save your life. Meet Vivian, a vibrant 67-year-old retired librarian from Phoenix who truly thought she was the picture of health. Every morning, she'd tend to her garden, cook elaborate meals for her grandchildren's visits, and prided herself on never missing her weekly book club. But you see, Vivian was ignoring 4 critical warning signs that her body was screaming at her every single day. She brushed off her morning joint stiffness as arthritis acting up, her breathlessness climbing stairs as being out of shape, her restless nights as hormones, and her sudden bursts of energy as finally feeling young again. Then came the day that changed everything. A routine doctor's visit that revealed her body had been trying to warn her about 3 life-threatening conditions for months. If you're over 60, Vivian's story could very well be your story. Have you noticed any changes in your daily routine that you've dismissed as normal aging? Drop a comment below and let us know. By the end of this video, you'll understand exactly what your body is trying to tell you and, more importantly, what action to take before it's too late. Number 1. The morning stiffness warning. Every morning, Vivian would wake up and struggle to get out of bed. Her joints felt like rusty hinges, and it took nearly 20 minutes before she could move normally. That's just what happens when you get older, she told herself, reaching for the heating pad that had become her constant companion. But Vivian didn't know she was ignoring her body's first death warning. Morning stiffness isn't just about aging. It's your body's alarm system alerting you to potentially fatal conditions. The valves that control blood flow between the chambers of the heart may become thicker and stiffer, and this stiffness can signal serious cardiovascular problems brewing beneath the surface. Here's what your morning stiffness is really telling you. If your joints are stiff for more than 15 minutes after waking, you could be experiencing the early stages of inflammatory conditions that dramatically increase your risk of heart disease and stroke. The inflammation causing your joint pain is the same inflammation attacking your arteries and heart valves. Stiffer valves can limit the flow of blood out of the heart or become leaky, both of which can cause fluid to build up in the lungs or in the legs, feet, and abdomen. But here's the critical warning most doctors miss. Sudden changes in your stiffness pattern can indicate an impending cardiac event. If your usual morning stiffness suddenly gets worse, lasts longer, or spreads to new areas, your body might be warning you about decreased blood flow or inflammatory processes affecting your heart. The inflammation connection is more serious than most people realize. When your immune system creates inflammation to fight what it perceives as threats in your joints, this same inflammatory response attacks the delicate lining of your blood vessels. This process, called endothelial dysfunction, is a precursor to heart attacks and strokes. Many seniors experience this dual attack for months or even years before receiving a proper diagnosis. The 15-minute rule could save your life. Time your morning stiffness from the moment you wake up. If it consistently takes more than 15 minutes to feel mobile, or if this time suddenly increases, you need immediate medical evaluation. This simple test has helped detect early heart disease in thousands of seniors before they experienced heart attacks. You can perform a simple assessment right now, stand up slowly, and note which joints feel stiff. Gently move each joint through its range of motion. If you experience pain that radiates from your joints to your chest, jaw, or left arm, this could be your heart sending a distress signal through referred pain pathways. Pay special attention to stiffness in your shoulders and upper back, as these areas often reflect cardiac stress before chest pain appears. The morning hours are when your cortisol levels naturally spike to wake you up. But if this process is impaired by cardiovascular disease, your stiffness may be more pronounced and longer lasting. For Vivian, this morning warning was connected to inflammation that was silently damaging her heart valves. When she finally understood what her body was telling her, she caught her condition months before it would have become life-threatening. Are your mornings trying to tell you something important? Share your experience in the comments below. Your story might help another viewer recognize their own warning signs. But this next warning is even more critical, and it happens every time you move. 3 months before her diagnosis, Vivian noticed something troubling. The stairs to her second-floor bedroom, which she'd climbed effortlessly for 15 years, suddenly left her gasping for air. "I'm just out of shape," she rationalized. But her body was sending her a desperate warning about impending heart failure. When the heart can't pump blood as well as it should, blood backs up in the veins that go from the lungs to the heart. Fluid leaks into the lungs and causes shortness of breath. This isn't just getting winded, it's your cardiovascular system crying for help. Here's the terrifying truth about breathlessness in seniors. People in the early stages of these heart diseases often don't have symptoms, or the signs may not be noticeable. By the time you notice significant breathing changes, your heart may already be operating at dangerously reduced capacity. The walking test that emergency doctors use could save your life right now. Can you walk up one flight of stairs or walk briskly for 2 blocks without becoming short of breath? If not, you may be experiencing early heart failure. Stage B or pre-heart failure means your left ventricle isn't working well or is structurally abnormal, but you've never had symptoms of heart failure. But here's what's truly dangerous. Breathlessness that happens during activities you used to do easily, especially when combined with fatigue or swelling in your legs and feet. Tiredness can have many causes. Sometimes it simply means that you need more rest. But feeling run down can be a sign of a more serious problem. Watch for these specific breathing patterns that spell immediate danger. Shortness of breath when lying flat. You need extra pillows to sleep. Sudden breathlessness during minimal activity, or feeling like you can't catch your breath even at rest. These patterns indicate that fluid is building up in your lungs, which can be fatal without immediate treatment. Coughing or wheezing that doesn't go away can be another sign that fluid is building up in your lungs. You may also cough up mucus that is pink or bloody. If you're experiencing persistent cough along with breathlessness, this combination demands emergency medical attention. There's also a hidden aspect of breathlessness that most seniors miss: the psychological impact. When your brain doesn't receive adequate oxygen due to poor circulation, it can trigger anxiety and panic attacks. Many seniors develop a fear of physical activity because they associate it with breathlessness, creating a dangerous cycle where they become less active and their heart condition worsens faster. The oxygen debt your body accumulates during these breathing episodes doesn't just affect your heart, it impacts every organ system. Your kidneys work harder to compensate, your liver struggles to process toxins, and your brain function can decline. This cascading effect explains why breathlessness often appears alongside memory problems, mood changes, and decreased mental clarity. For Vivian, her breathlessness was the second piece of a puzzle that revealed her heart was operating at only 40% capacity. Her cardiologist later told her that catching this warning when she did likely prevented a massive heart attack within the next 6 months. The immediate action you need to take: if your breathing has changed in any way over the past month, document it. Note what activities trigger breathlessness, how long it takes to recover, and any associated symptoms like fatigue or chest discomfort. This information could be life-saving when you speak with your doctor. How's your breathing during daily activities? Have you noticed any changes that you've been attributing to aging? Share your experience in the comments. Your awareness could help others recognize this critical warning. The third warning happens every single night, and missing it can be fatal. For months, Vivian tossed and turned every night, waking up exhausted despite spending 8 hours in bed. She snored loudly, gasped for air, and felt like she was suffocating. It's just menopause, she told herself, but her body was warning her about a condition that kills seniors silently during sleep. One other study reported a 2.57-fold increase in the relative risk of nocturnal or nighttime sudden cardiac death in patients with obstructive sleep apnea between midnight and 6 a.m. compared to the general population. Sleep apnea doesn't just make you tired, it can literally stop your heart while you sleep. Here's the deadly connection most seniors don't understand. When their oxygen saturation levels dipped below 78%, preventing air from flowing into the lungs, their risk increased by 80%. Every time you stop breathing during sleep, your oxygen levels plummet, forcing your heart to work dangerously hard to keep you alive. The 10,701 subjects were followed for an average of 5.3 years for incidents of resuscitated or fatal sudden cardiac death. In that time, 142 patients experienced sudden cardiac death, with the most common predictors being a patient aged 60 years, having 20 apnea episodes an hour and having a lowest oxygen saturation level of below 78%. The signs that require immediate medical attention: loud snoring followed by silent periods where you stop breathing, gasping or choking during sleep, waking up with severe headaches and feeling exhausted despite a full night's sleep. Sleep apnea puts increased stress on your cardiovascular system. When you stop breathing at night, your oxygen levels drop, and that causes your heart to have to work harder to get oxygen to the organs and muscles that need it. But here's what makes this warning particularly insidious. From midnight to 6 a.m., the frequency of sudden death from cardiac causes was significantly higher in persons with obstructive sleep apnea than in persons without obstructive sleep apnea, 46% versus 21%. With a p-value of 0.01. While most people are safest during sleep hours, seniors with undiagnosed sleep apnea are most vulnerable. The nighttime tests that could save your life? Ask someone to observe your sleep or record yourself sleeping. Count how many times you stop breathing for 10 seconds or longer in an hour. If it's more than 5 times, you need immediate evaluation. Sleep apnea is diagnosed when you stop breathing for 10 seconds or longer, at least 5 times an hour during sleep. What many seniors don't realize is that sleep apnea creates a vicious cycle that accelerates aging and disease progression. Each breathing interruption triggers a stress response that floods your system with cortisol and adrenaline. Over time, this chronic stress response damages your immune system, accelerates cognitive decline, and significantly increases your risk of diabetes and stroke. The connection between sleep apnea and memory loss is particularly concerning for seniors. During deep sleep, your brain naturally clears out toxic proteins that contribute to Alzheimer's disease. When sleep apnea repeatedly interrupts this process, these toxic proteins accumulate faster, potentially accelerating dementia. Watch for these additional sleep warning signs: waking up gasping for air, feeling like you're choking, persistent morning headaches, extreme daytime fatigue, and falling asleep inappropriately during the day. A couple of studies have shown that people with untreated moderate to severe sleep apnea are 3 to 6 times more likely to die from any cause than those without sleep apnea. For Vivian, her sleep study revealed she was stopping breathing 47 times per hour, with oxygen levels dropping to dangerous 72%. Her sleep specialist told her this pattern significantly increased her risk of sudden cardiac death and stroke. What's your sleep been like lately? Do you wake up feeling rested, or do you feel like you've been fighting all night? Tell us in the comments about any sleep changes you've noticed. But the final warning is the most dangerous because it feels good, and that's exactly what makes it so deadly. 2 weeks before her life-changing doctor's visit, something strange happened to Vivian. After months of feeling tired and sluggish, she suddenly felt amazing. She had energy she hadn't experienced in years, cleaned her entire house in one day, and felt like she could conquer the world. She thought she was finally getting better, but her body was sending her the most dangerous warning of all. Sudden bursts of unexplained energy in seniors can signal life-threatening medical emergencies. This deceptive warning feels like a gift, but it's actually your body's last-ditch effort to compensate for failing organ systems. Unfortunately, congestive heart failure usually gets worse over time. As it worsens, you may have more or different signs or symptoms. Here's why this energy surge is so dangerous. When your heart is failing, your body releases massive amounts of stress hormones like adrenaline and cortisol to keep you functioning. This creates artificial energy that masks the underlying crisis. You feel great while your organs are actually shutting down. Blood sugar emergencies that feel like energy boosts. Dangerous blood sugar swings can create euphoric feelings of energy followed by crashes. In seniors, these swings can indicate diabetes complications, medication interactions, or organ failure. Diabetes deaths, sometimes called dead-in-bed syndrome, may stem from low blood sugar during the night, particularly in younger people with type 1 diabetes. Thyroid storms disguised as vitality. An overactive thyroid can suddenly flood your system with hormones, creating intense energy, racing heart, and feelings of invincibility. This condition can trigger heart failure, stroke, or cardiac arrest without warning. The energy feels wonderful, but your heart is being pushed beyond its limits. The medication masquerade that kills the dangerous drug interactions or organ failure can cause medications to build up in your system, creating unexpected energy bursts. Your failing liver or kidneys can't process medications properly, leading to toxic levels that initially feel energizing but quickly become fatal. Hidden organ failure presenting as energy surges. When your liver or kidneys begin to fail, toxins build up in your blood. Initially, this can create euphoric feelings and unusual energy. By the time you feel sick, organ damage may be irreversible. Kidney failure is a serious complication that can develop silently. Emergency situations disguised as feeling great. Heart rhythm abnormalities can create feelings of racing energy and euphoria right before causing sudden cardiac arrest. A fast or uneven heartbeat can also be a sign of an arrhythmia. This is a problem with your heart rate or rhythm, the psychological trap that prevents recognition. The relief of finally feeling good again after months of fatigue creates powerful denial. Your brain wants to believe you're recovering, so it dismisses subtle warning signs like slight tremors, increased heart rate, or mild confusion that accompany these dangerous energy surges. Terminal lucidity is another phenomenon where people with serious illnesses suddenly seem to recover their energy and mental clarity days or weeks before death. This temporary improvement can give families false hope while actually indicating the final stages of organ failure. The tracking system that could save your life? Document your energy levels daily on a scale of 1 to 10, noting any sudden changes, especially increases. Record what you were able to accomplish, your heart rate, and any other symptoms. Sudden energy spikes of 3 or more points from your baseline require immediate medical evaluation. Red flags that demand emergency attention. Sudden ability to do activities you couldn't do the week before, feeling high or euphoric without cause, racing thoughts or heart rate, sudden weight loss combined with energy, or feeling like you have superhuman strength. For Vivian, this energy surge was her body's final attempt to compensate for her weakening heart. Her doctor later explained that this pattern often occurs 1 to 4 weeks before a major cardiac event. Recognizing it as a warning instead of a recovery potentially saved her life. Have you experienced unexpected energy changes that made you feel like you were suddenly getting younger? We want to hear about it in the comments. Your experience could help others recognize this critical warning sign. Today, 2 years after that life-changing doctor's visit, Vivian's life tells a completely different story. By recognizing her body's 4 daily death warnings, she caught 3 serious conditions: early moderate heart failure, severe sleep apnea, and dangerous blood pressure fluctuations that were setting her up for stroke. Her morning stiffness led to discovering inflammatory markers that indicated her heart valves were under stress. The breathing test revealed her heart was pumping at only 40% capacity. Her sleep study showed she was stopping breathing 47 times per hour, with oxygen levels dropping to life-threatening 72%. And that deceptive energy surge? It was her body's last attempt to compensate before complete heart failure. The specific actions Vivian took changed everything. She started heart failure medications that improved her heart function from 40% to 65%. A CPAP machine eliminated her sleep apnea and reduced her cardiac death risk by 80%. Anti-inflammatory protocols addressed her morning stiffness and protected her heart valves, and careful monitoring prevented the dangerous energy swings that could have triggered a cardiac emergency. Vivian's transformation is remarkable. She now climbs stairs without breathlessness, sleeps peacefully through the night, wakes up refreshed instead of stiff, and has stable, sustained energy throughout the day. More importantly, her cardiologist says she likely prevented a massive heart attack that would have occurred within 6 months. Her message to other seniors is powerful. I thought my body was betraying me, but it was actually trying to save my life. Every ache, every breath, every restless night was a gift, a warning that gave me the chance to fight back. Don't ignore what your body is telling you. It's not giving up on you, so don't give up on it. You have the power to listen to your body and act on these warnings. Don't wait until tomorrow to start paying attention. Your life may depend on recognizing these signals today. If this video opened your eyes to what your body might be telling you, smash that like button right now. This information could save a life. Share it with someone over 60 who needs to see it today. Which of these 4 warning signs resonated most with you? Drop a comment below and let us know what you've noticed about your own body's signals. Don't miss our life-saving content for seniors. Hit that subscribe button and ring the notification bell.